Hi, good afternoon. I'm Michelle Grazoulis, and I'm president of the Foundations at Rochester Regional Health. Happy to have you here today as we talk about, orthopedics. And I'm joined today by Dr. Rami Elshaar and Dr. Kate Grant, both of whom are orthopedic physicians at Rochester Regional Health. And before we get started, first of all, thank you for joining me today.
Thank you so much for
Happy
having
to
us.
have you here. And before we get started, I wanted to just ask you guys, tell me a little bit about your specialties and what you both do.
Yeah, go ahead.
So I take care of athletes and the community doing non-surgical orthopedics. So I trained in primary care and then did a fellowship in sports medicine. So I see almost anything that walks through the door. And then when it needs surgery, I'll send it along to my partner.
I could have seen both of you when my kids were younger. How about you, Dr.
And I'm an
Elshaar?
orthopedic surgeon. I actually trained at
Okay.
the University of Rochester
Okay.
and went off to Los Angeles to perform a sports medicine fellowship at Curl and Job, where I took care of actually a lot of professional teams in LA.
Okay.
And now I'm back here. And really I focus on shoulder, hip, knee, elbow, a lot of joint injuries.
Okay.
Sports related or not. And I'll also be doing shoulder replacements.
Okay. Wow, that's interesting.
You know.
Great. We're so glad to have you guys here
Thank
today.
you.
So, as always, I invite the audience to ask questions in the comment section, and we'll try to get to them while we're talking. And as you both know, this is a really exciting time for our orthopedics team as we open up a new office in Perinton. So I want to talk a little bit about that. So Dr. Elshaar, could you talk a little bit about that office and some of the work that's going to be done in that space?
Yeah, absolutely. It is really an exciting time for really our department as a whole and our system. Really our goal as a system is to provide comprehensive and really exceptional orthopedic care to our patients. I'd say one of the challenges for orthopedic patients and their injuries is travel and accessibility.
Yeah.
And so really having this new location will give us another option.
That's great.
To have those patients come there.
And you'll both be seeing patients there?
Mm-hmm.
We will.
Okay, great. So so talk a little bit about the rest of the team that we have there and what sort of services will be provided and the breadth of services that will be provided in our Perinton office.
Yeah, we'll actually have a great group of orthopedic specialists there, really covering all subspecialties of orthopedics. We'll have myself and Dr. Grant there a couple days a week, as well as Dr. Colin Canham, and he specializes in hip and knee joint replacement and does anterior hip replacements as well.
Okay.
And we'll also have Dr. Christopher Brown there as well, who also specializes in sports medicine.
Okay, great. Thank you very much. So Dr. Grant, I know from learning about you that one of your special areas of interest is concussion. Can you talk a little bit about that for us today?
So during my fellowship, we do get special training in concussion. It fits certainly more with the primary care model that I initially trained under and then did my fellowship in. And so the concussions we see run the gamut of sports injuries, but also in people in the community, motor vehicle accidents, slips and falls at home on the ice. This time of year we see
That's what I'm
them
saying.
quite a bit. So any type of head injury is something that we will see. The nice thing about the concussion clinic that we have at Unity at Ridgeway
Yes, very
is that
familiar
it
with it.
is very comprehensive there. We have sort of all the tools we need to get them better, myself as well as the other physicians, but also physical therapy and some advanced care should they end up needing that.
Yeah, and let's talk about this time of year. I want to get to that, but I wanted to ask you too, how did you get drawn into concussions? That's interesting to go from your training and then also your sports medicine.
Yeah, so when I was doing my training, the concussion treatment and kind of the evaluation of it has changed a lot, even since I graduated from medical school. We certainly have changed the way we treat them over time. Concussion, I think, is obviously a huge buzzword in the community with the NFL. You hear it all over the place. And so I think parents, particularly with putting their kids in sports, want to know that they are going to get the right kind of treatment. If they do get a concussion, what to do next. So I think it's really important educating the community about concussions and that sports are good and that it's okay to keep doing them, but making sure you have the right kind of plan in place.
And the right equipment to protect your noggin while you're playing sports. So let's talk about this time of year because the weather is such. You talked about slips, trips, and falls. We talked about orthopedic injuries. So for both of you, what are the primary increases in injuries that you see this time of year as a result of snowy or slippery weather?
I would say I see a lot more fractures this time of year from slipping on ice and falling. And with school break, I see a lot of kids doing skiing, but I've seen a lot like roller skating or trampoline park because they're home and they're off. So I tend to see much more fractures at this time of year.
Yeah. Dr.
Yeah,
Elshaar, for
no,
you?
there are a lot of sports-related injuries as well. Like you said, skiing, snowboarding, ice skating, ice hockey, even sledding. I mean, you'll see injuries with all these different types of sports. And I think one of the most important things I'll tell my patients is really focusing on stretching and warming up prior to any activity. I'd say one of the things for the skiers and snowboarders out there is really know your limitations. There's a lot of fractures that we see, a lot of even joint dislocations from falls and from pretty traumatic injuries. So just being aware of your limitations, having the right conditioning and strength training prior to that is really important.
And recognizing we're not invincible.
Yeah, exactly.
So we talked about stretching and stuff, but I think one of the things that I know from doing a lot of these too is the injuries that happen around wintertime with shoveling. So back injuries that people, because I think people don't anticipate how difficult it is. So do you see an increase in injuries from shoveling this time of year? And what would be your advice to people listening about how to sort of prepare their body for it and protect themselves?
Yeah, interestingly, you do see a lot of injuries, lower back, soft tissue injuries, as well as even shoulder injuries. So I'd say a couple tips would be wear slip-resistant shoes and boots to prevent any falls. In addition, I'd say, again, taking breaks, knowing your limitations. You don't have to do that driveway in 10 minutes, take your time. But really, I'd focus on keeping your arms and elbows close to your side. Any type of overhead shoveling or overhead activity is really going to increase the stress on your shoulders. And I've seen rotator cuff tears from something as simple as shoveling the snow.
It's amazing.
Yeah.
I was talking to my wife at home and I told her we were doing the stage. She said, would you ask about shoveling? So I asked about shoveling.
There you go.
We will just to mention also have a spine presence at our new office as well.
Oh, that's great.
Yes,
that's
we'll
fantastic.
have John Scott, who's physician assistant with Dr. Gordon Whitbeck, with us one day every other week.
That's
so
really
that will be
that's
helpful
very
also.
comprehensive care for us and gives us a whole new footprint. That's on Sully's Trail, correct?
Yep. Yes.
Okay, great. Okay, so let's talk about some of the new procedures that we're doing here at RRH that put us on the forefront of orthopedic care. And I'd love for both of you to comment on this as well, but I'd like to start with you, Dr. Grant.
So one of the newer techniques that has been sort of building just in the sports medicine orthopedic world in the last couple of years is using orthobiologics, which means a few different things, but probably the most common procedures is being able to take stuff from your own body and re-injecting it back into different areas, injuries, joints.
So like stem cells?
So one is something called PRP, which is just a peripheral blood draw, and take the blood, put it in a machine that spins it down, and then you re-inject part of that back in. Goal of that is to stimulate healing, essentially. And then there is another technique, which is mesenchymal stem cells, that we use a bone marrow aspirate to do that. So they work a little bit differently, but the end goal of both is to stimulate some healing. The bone marrow, the evidence is showing that it's more for kind of cartilage articulation kind of healing. So it's a newer type of technique. Still a lot of research, but the research seems promising and certainly heading in a new direction.
For spine care as well as sort of joints, what I'm thinking about is it particularly in one area that we're doing that? Or?
Most of the research, as far as like with the bone marrow, is more knees. Most of the studies are knee-based. The PRP can be used really a lot with tendons, tendon-type injuries, tendinitis, tennis elbow, we use it a lot, patellar tendinitis. And that's been around a little bit longer, so better kind of data behind that.
And is that primarily for recovery from injury or for degenerative sort of areas that occur as we get older?
You can use them for degenerative areas. The PRP I think initially was a little bit geared more toward injury, but is starting to show some promise with some degenerative changes.
I'm aging.
But the bone marrow aspirate that we use tends to be a little bit more kind of geared toward, again, that degenerative changes that we see.
And we're doing this now.
Yes.
Fascinating.
Yep.
Fascinating. Anything on the forefront in the sort of surgical space that you want to talk about that we're doing that is really on the cutting edge? Or
Yeah, I mean, really, there's a lot of development, especially with biologics.
Yeah.
Sometimes incorporating surgery with biologics is helpful.
Interesting.
So, there's still research that needs to be done on that, but there has, really the biologics are going to increase your growth hormone levels as well as decrease the inflammation within the joint, hopefully promote some healing while decreasing pain. But really for, say, rotator cuff repairs,
Yeah.
some people have actually utilized PRP or stem cells to really allow, improved healing.
Okay.
With the surgery as well.
Really interesting.
Yeah. So really combining both aspects of it.
There is another newer technique that we're doing also, which is called percutaneous tenotomy, which is
Okay.
also helpful with tendon injuries and overuse injuries.
Okay.
So it is essentially taking like ultrasonic type needle to trying to breed out the bad tissue in a tendon and leaving the good tissue, and again try to stimulate some healing.
Yeah.
And so that's done at our outpatient surgery center.
Okay.
No anesthesia, just local. Procedure maybe takes 15-20 minutes depending on the area. But
So-
another kind of promising newer technique that's out there.
For people listening, clearly if you have an injury, you go to your primary care most likely and say, okay, I have an injury, or if you're already connected with an orthopedic doc. But for something like what you're talking about, help the people listening understand what's the first step. So to meet with your primary care and say, I'm having these issues, and then they will think about the appropriate care plan and, okay.
Yes, so
Okay.
once they, if they seek out their primary, they can refer them obviously to our office.
Okay.
And as myself being non-surgical and sports medicine, I kind of think of myself as sort of the first line of defense to figure out what is surgical and what should go to my partners and
Yeah.
what can be treated a little bit more conservatively, especially initially. And obviously we don't jump right to the biologics
Yeah,
and
of course.
the percutaneous tenotomy right off the bat. We try to do other things, therapy, and treat them conservatively. But when those things are not working the way that we think they should, we'll move on to newer techniques.
We're fortunate as a health system as well to have the breadth of care provided in the ortho space that allows us to move from the non-surgical to the surgical and then to the therapy piece pretty seamlessly.
Yeah,
Which
one of
is
the things, if you don't mind me adding, is
No,
just
not at
actually for
all.
this new location, all the orthopedic providers are going to be accepting walk-in visits. So even if you have an acute injury or a new injury that you fell or wanted to get something looked at in really a timely fashion, it really gives us an opportunity to see a patient, diagnose them, and treat them in a timely manner.
I'm going to say that again because I think people listening might have, because it just caught me by surprise.
Yeah.
So we're going to actually have walk-in.
Yeah, so we'll be accepting walk-in visits every day. We'll leave a few slots just in case somebody does get injured that day and needs more urgent evaluation.
That's incredible. I know from having 2 children who'd been
Yeah.
injured and stuff to get people, to get
Yeah.
your child in or anybody in on short notice. That's great. And we're doing that in the Sully's Trail location.
Sully's Trail, yep.
Okay.
The goal, is to get them in as quickly as possible.
Yeah.
So.
Yeah, that's great. Okay, so let me stop and see if there's any questions from the audience, Allison.
Back to the winter sports. So
Yes.
we're seeing more and more helmets out there. What about like wrist guards, knee guards? Do those help? Do those actually prevent anything, or do they not, from what you've seen?
Well, it depends on what sport you're doing. I think it's a great question, and it's something that I have seen. Really, again, depends on the sport. If you're on the ice and if you unfortunately fall, it may protect you. If you have a propensity to fall, it may give you a protection for your wrists especially. But sometimes these braces may not prevent any type of fracture or
Yeah.
injury. They might lessen the blow to some degree, if that makes some sense, but it's a great question.
I do think I can only imagine in your practice, the sort of weekend warriors that all of a sudden become really good at doing something in the winter that they've never done
Yeah.
the rest of the year. And
Exactly, yeah.
it's the conditioning in the years in the intervening time that's really important.
That's
Yeah.
unfortunately some more of the injuries that we see is
Yeah.
even with high level athletes who are training all the time, again, focusing on stretching and warming up beforehand and knowing your limitations.
Yeah, and the wear and tear.
Yep.
That because we did one of these a few months ago where we talked just about for younger folks today too, that a number of injuries, but it has to do with how hard they're pushing themselves
Yeah.
and not necessarily doing the strengthening and conditioning to be prepared to do
Yeah,
that.
exactly.
So I like to do a speed round. I don't know if you guys are prepared for this or not, but so I like to let the audience get to know our physicians a little bit better because, you know, I'm in awe of the work that all of you do, and I get the privilege of working with a lot of our physicians on a regular basis. So I want to start with, what are your favorite sports teams, Dr. Grant?
The Yankees.
Okay.
I'm a diehard Cleveland sports fan. I
Okay.
grew up in
Any Cleveland sports.
Yeah.
Okay.
So it's
okay.
been miserable for most of my life, but it's been good.
You know, as long as you hang in there, eventually. Are you a New York native?
I grew up outside of Utica in New
Okay.
Hartford, but just my
Adopted the Yankees.
Yep.
Okay. Did you play sports in high school?
soccer.
Soccer?
Basketball, soccer, tennis. I played tennis in college.
Okay. What's your favorite sport?
I like basketball.
Okay. For you?
Probably baseball.
Yeah?
I like watching baseball. Yeah.
Great. And I always love to ask this because I think it's fascinating to learn. What made you become a doctor? I'm going to ask you this, and now you get time to think about it.
It's a really good question. So I always really liked science and really liked biology.
Okay.
And so I thought I wanted to do medicine, but I wasn't actually sure that I did. So when I went to college, I was a bio major.
Okay.
And we had an excellent pre-med advisor who pushed me into that direction, who was very helpful. And then I was able to work at a local hospital on my breaks and summers off. And so
Became your calling.
just decided I really liked it and wanted to go ahead with it. So
And then orthopedics blended for you, the sports medicine.
Mm-hmm. Yeah, so when I went to medical school, I actually thought I wanted to do the surgery part of it. And then I ended up doing my rotations and really sort of liked being in the office much more than the OR.
Yeah.
I like talking a lot, and so I liked spending the time with my patients more than standing over them. So, and I really liked casting and injecting, which I get to do a lot of.
Yeah.
So that's how I ended up.
Interesting.
where
Thank
I am.
you. Dr. Elshaar?
Well, I'd say growing up, I really admired the physicians that really helped my family and I through difficult situations. And I think that kind of shaped me and guided me towards this practice where I can support and provide care for my community. Actually seeing patients now in my office, there's probably no greater feeling for me to see people overcome their injuries and really get back to their life and their activities and sports. And so for me, it solidifies, my decision.
And what about the decision to become a surgeon? What was that sort of, you just liked the reconstructing?
I might be the complete opposite where although I enjoy, that experience and talking to patients and really connecting with them and trying to get them to overcome those injuries, I also really enjoy working with my hands and that operative aspect of it. So.
And how long have you both been with Rochester Regional Health?
I started in August.
Okay.
Yeah, I started just shortly after.
Okay. Well, we're glad you're here.
Yeah.
And I appreciate you sharing with us a little bit about yourselves and also talking a little bit about orthopedics. So, before I wrap up, I want to make sure the audience listening knows that our new office in Perinton is located at 77 Sully's Trail. And if you'd like some information, please visit www.rochesterregional.org. And Allison, any other questions? Okay. So first of all, thank you both for joining me. I really, really appreciate it and look forward to having you back on at some point to talk about what happens in the spring or summer with injuries, because I'm sure there's a slew of them. They're just different. And if you have any additional questions, for those of you watching, feel free to leave us the questions and we'll be sure to get them answered. So Dr. Elshaar, Dr. Grant, thank you so much for being here, and
Thank
I
you.
wish you a great holiday season.
You too.
Thanks so
Thank you.
much.